You wrecked your hand in a fight. You went to the emergency department and they said you had a broken bone. They put you into a splint, you didn't see a specialist, and you kept it on for 8 weeks just to be sure it healed. Or maybe you had surgery on your hand and it hurt, so you didn't move your fingers for 2 months. Now you can't move your hand. It's time to get it right before it becomes permanent. When we cannot use our hands normally, it can be a significant form of disability in that it can affect just about every aspect of our lives. This video is part 2 of a 2-part series on hand stiffness. If you missed part 1, go back and watch it first. It covers prevention and early recovery. I'm Dr. Lucius Pomerantz, board-certified orthopedic surgeon and hand specialist. And what this video covers, it's an abbreviated guide to restoring motion, understanding when and how to stretch and splint, and understanding what real recovery looks like, including expected timelines, the people and tools involved, and how difficult the problem of hand stiffness is. Keep in mind, this video does not replace being evaluated by a specialist or guided by a hand therapist. I hope this video can give you a fundamental understanding of what it takes to overcome stiffness after an injury. First, a quick recap of the healing phases. It's really important to understand the healing phases, as this does guide treatment. I go deep into these healing phases in my wound healing video, check that out, but here's a quick summary. First stage, inflammation. This is crucial and an important stage. It's clearing up damage, it's recruiting our immune system. It often results in pain and swelling and can result in additional stiffness down the road. Next stage is the proliferation stage. This is when collagen is being laid down. Collagen is the all-important foundation of our soft tissues, but the combination of collagen fibers must be able to glide and move past each other. Collagen crosslinks can develop if the collagen fibers are not moved, and this is where stiffness really starts happening. And lastly, number 3, remodeling. Collagen is remodeled and reorganized over time, and this is a process that takes many months, sometimes even a year. The first part was about the early stages and preventing bad stiffness. This video, we're focusing on the later stages of healing and treating the limited motion that can happen, the timing balance. In recovery, after injury, there is a balance in restoring motion. If you move too much or too soon, you inflame things and slow healing. You wait too long, you scar in and get stiff. You need skilled professionals to guide the timing and intensity of your rehab and find the balance. While I'm going to be talking about timelines, these are general guidelines. Everyone's recovery is very individualized based on their injury, their unique goals, and how they are healing. Why are you stiff? Let's say it's been more than 6 weeks since starting motion and it hasn't come back. We need to figure out why. First, we'll go over some definitions. Active range of motion. This is what your brain can actively make your body do. Passive range of motion is what your body can do with some outside help. Possible causes of stiffness that we need to figure out. 1, the joints are stuck due to ligament tightness or joint capsule tightness. We can assess this if passive range of motion is limited in all hand positions. Another cause is if tendons are getting stuck, they're adherent to tissues around them. A clue to this happening is if the joints further down from a tendon just won't move. Say you cut a tendon at the back of your hand, the finger joints further down are going to be tight and not want to move. A similar related cause are if muscles are shortened. This is, again, similar to tendons, but the whole muscle unit won't move. An example that we use to assess for this is the Bonnell intrinsic test. This is testing the little intrinsic muscles of the hand, the little muscles of the hand that make our fingers move. And the way we test this is we actually put tension on that muscle tendon unit. We do that by extending the MCP joint of the finger. And if that gets particularly tight, we'll actually notice that the PIP joint has more difficulty bending. Another cause of stiffness is scar tissue, especially at the skin. A way of assessing this is you might get skin blanching, or it gets white when trying to move. You may also be able to feel that there's tightness or that the skin is stuck to underlying tissues. And then the last major cause of stiffness may be brain-driven movement avoidance. For some people, the avoidance of pain, or the ability to work around the injury can result in less brain-body connection. A way that we can try to assess this is the patient may have normal passive range of motion, but when trying to do things actively, you notice that they have just poor coordination, or there's guarding, meaning they're mentally kind of blocking motion, or when you watch them move around and do things, they've learned to kind of just ignore the body part. Sometimes it's a combination of all or some of these things. Targeted treatments. It's very important to target each problem. These treatments could include tissue and scar massage, guided range of motion, as well as stretching. And then there's splinting, and this will include dynamic and static splinting, which we'll get to in a little bit. And then there are neural retraining techniques. Massage, range of motion, stretching, and splinting can help improve circulation and break up adhesions and help reshape scar tissue. All of these are focuses on the mechanical blocks to motion. Then there's neuro repatterning or retraining. This could include things like mirror therapy or proprioceptive drills, and these help restore your brain's connection to your body. The role of splints. Splints are a double-edged sword. A poor fitting splint or wearing one too long may be the reason why you are struggling to move right now. Too much immobilization can cause stiffness by allowing those collagen crosslinks in our soft tissues to form. But splints can also be part of the fix when used right. This is almost always guided by a skilled occupational or hand therapist. As mentioned in the first video, in the inflammatory stage, when things are angry and swollen and painful, we often use a safe position splint. This is where the wrist is extended, the knuckle joints, the MCPs are flexed, and the PIP joints are extended. This is keeping the muscles and tendons and joints in an optimal length while resting. Of course, exceptions are made depending on the underlying injury and what other things might be going on. As healing progresses, splints should be custom and often are guided by that hand therapist. This is based on their exam and working with you on a frequent basis. Dynamic splints. These allow for controlled motion, kind of like training wheels on a bike. Then static splints. These hold tissues often in a stretched position, trying to get things to lengthen and restore motion. The expected timeline. It is very important to emphasize that recovery from stiffness is not overnight. It's going to take a long time. Also, there is a window of time in which you can get motion back. Once stiffness sets in, it can be really hard to treat. I usually say it takes at least as long as you were immobilized to start feeling more normal again. For a hand fracture that took 6 weeks to heal, you may need 6 more weeks of focused rehab. By 1 month of working on range of motion, we want to see some progress. By 3 months, we expect to see major improvement, though that being said, full recovery can take 6 months. Again, push too hard, you flare up. Skip therapy, stiffness is going to linger. Balance is everything. When to consider surgery. Surgery is the last resort and can only be used in certain situations. So you tried therapy, it did not work. Surgery can be helpful if, 1, there's a bony block. Ideally, this would have been addressed initially, but if a joint's malaligned or a fracture's healed in a weird way, we can often adjust this. Next, number 2, adhesions have locked down tendons or joints. 3, skin or scar is so tight that it's restricting motion. Part of this is if a scar is crossing a joint, and this is why us surgeons are very careful not to make an incision straight across a joint, as this scar can prevent motion. And this is why with surgery, you might see zigzag incisions that are crossing joints, but not straight in line. And the different surgeries may involve removal of scar tissue, releasing or cutting ligaments, or reconstructive techniques like skin lengthening. Sometimes we can fashion what's called an external fixator, and this will have pins that go into bone and rods that are connecting them, and these can be used to progressively stretch tissues over time to kind of crank them out to length. You may be realizing, yes, surgery is more trauma, and this was the cause of the underlying issue. But you can also think of surgery as restarting the healing process. With the right postoperative care, motion can be regained, but often there will be some continued limitations. Surgery for stiffness is rarely perfect, especially at these darn PIP joints, which are notoriously stubborn. So some final words. Hand stiffness is fixable, but only if you take it seriously. It is way better to prevent it than to try to treat it later. And just like everything, treatment is individualized, and there's a balance between rest and motion that is best guided by a specialist. Like, share, tag someone who's dealing with this stiffness, and subscribe for more recovery medicine from a surgeon who's been in the ring and dealt with these problems both as a surgeon and as a patient. I'm Dr. Lucius Pomerantz, orthopedic surgeon and hand specialist. Thank you for watching.